He is the adjunct lecturer at Tokyo Medical and Dental University. He is an international renowned endodontist, pioneer of the file technique. Ladies and gentlemen, welcome to a special episode today. We have the privilege of hosting a distinguished guest, Professor Dr. Yoshi Terauchi. Hello, Doctor.
Hello, everybody.
It is an honor to have you among us. I'm Rani, your host of today. I'm sure many friends here know Dr. Yoshi, but there might be some who are not quite acquainted with yourself. Could you please give a brief introduction of yourself?
Okay, my name is Yoshi Terauchi, but my actual name is Yoshi Terauchi, but many people call me Yoshi, so Yoshi is easy to pronounce, so you can call me Yoshi anywhere. And my practice is limited to endodontics. My practice is in Tokyo, Japan, and I see 6 on average patients a day. And I charge a lot for my work. And I think many people know me in Japan because I have lots of patients waiting for me to treat them. And the next patient making an appointment with me has to come to my office next April. So there's a wait list just because I'm very expensive and my technique should be very, very good, and my success rate is very, very high, and that's why I think I'm popular. I hope so.
Thank you. I'm sure over the years you had many challenges doing a root canal treatment. Can you share with us a case that it made a difference or changed your procedure for life?
Okay. First of all, I received lots of referrals from dentists everywhere in Japan and even outside Japan. And I only received difficult cases. So the most challenging cases, if I call it, would be the case where I cannot see the broken instrument because it's beyond the curvature. Sometimes the broken instrument outside the root. So in that case, I have difficulties removing the broken instrument.
With your wealth of exposure, what factors do you consider a successful endodontic treatment?
Successful treatment?
Yes.
Okay, because you need a definition of success. Because the definition of the success is to attainment of the specific goal. Yeah. So if I call the case success, the region, the epical region has to be completely gone, and also the tooth must be asymptomatic. So that's the goal I'm always looking at.
Okay. A root canal treatment is not always 100% successful.
Yeah.
And as we know, there is always a case of failures. Could you please share with us some common errors that a dentist during the procedure might cause this failure?
Yeah. It's a very, very good question. So if you ask me my success rate in the treatment is 99.4% for 7 years. And what is a 0.6%? My failure cases include vertical root fracture that I didn't identify because it was on the lingual side. Okay. Even if you do the surgery, it's difficult for me to locate the vertical root fracture on the lingual side. Yeah. And if I find the biofilms on the lingual side, it's also difficult for me to find. So anything on the buccal side can be very, very tricky. So my failure cases always include the vertical root fracture on the lingual side and the presence of biofilms on the lingual side. And I only find them when I extract the tooth.
Okay.
Yes. Anyway, those kind of tools will be extracted because of the vertical root fracture. Yeah.
So could you also share with us the correct procedural methods?
Method to
there is the
to remove the instrument
to retrieve an instrument.
To retrieve the instrument.
Yes.
Okay. First of all, you have to make a diagnosis, an accurate diagnosis using the CBCT, because without CBCT, nothing can be predictable, because you have to see a tooth three-dimensionally. So you need a CBCT to make an accurate diagnosis. And based on the accurate diagnosis, you have to make a treatment plan. Without the treatment plan, you have almost no idea what you are doing. So first, you have to set the goal of your treatment. Then you make a diagnosis. And based on the diagnosis, you will make a treatment plan. Then you will start preparation for broken file removal. The first step for the preparation is to enlarge the canal to the broken instrument, and it has to be enlarged in a funnel shape, because without creating a funnel shape, the flow speed inside the root canal will be decreased toward the coronal end of the root canal. Then you need to create a space on the inner wall. So you have to identify the location of the inner wall with the CBCT before you touch the tooth. Then expand the space with ultrasonic tape to 180-degree semicircular space until you see the instrument dancing. If you see it dancing, that's the end of the preparation. Then you can make a removal attempt using ultrasonics or the loop when the broken instrument is longer than maybe 4.5 millimeters, or you can use a rotary file like the XP Endo shaper or finisher if the broken instrument is leaning against the outer wall, because it's impossible to place a loop over the broken instrument if there's no space on the outer wall. And or maybe you can use simply the air that you can use to blow the broken instrument out. So this is how you can remove the instrument.
Thank you. For dentists, the device should be part of the procedure.
Mm-hmm.
What dentist should take and prioritize when is purchasing or looking for a new motor or any new device?
Okay. First of all, I really want a motor that can exceed the speed more than maybe 2,000 RPM, because I need higher speed when I use a GG bar or maybe the XP Endo shaper.
Yes.
That has to be, fast enough to prevent the fracture of the instrument, because the small instrument is very susceptible to torsional fatigue. If you want to prevent the torsional fatigue, you need to increase the speed. So that's why I always look for a motor that can have the speed higher than 2,000 RPM. So that is the AI motor. And the next thing I'm looking for to operate the root canal is the 812 MT, because many people told me it's very difficult to operate the canal with MTA without any technique. So that's why I developed the motor 812 MT, and anything with high technology is good.
Okay. For the audience, maybe they have a question to ask us is, how you came to know about woodpecker?
Okay. I went to Istanbul for APEC. That was 2017, if I'm correct. If not, tell me. And I met Becky.
Okay.
Yes. And Becky showed me many beautiful devices, like the motors and ultrasonic units.
Yes.
I was deeply impressed with the technologies.
Okay.
Then I was invited to Woodpecker in Guilin. Then when I saw the facilities, here,
Yes.
I was also deeply impressed with all the technologies here. And I instantly loved woodpecker. Yes.
That's good. And of course, you fell in love with its stuff.
Yes. I first fell in love with the technology that woodpecker provides. Then I fell in love with people working here.
So if you want to describe woodpecker in 3 words, what will be?
Honesty and hardworking and trustworthy. I think woodpecker is the best company in the world because of the trust. Because woodpecker is different from other companies, including Japanese companies, because they're very friendly to even the key opinion leaders and also everybody. So, who hates woodpecker?
I hope no one. So over the years, you have we forged a good relationship.
Mm-hmm.
And that relationship, as you described it, is basically on trust.
Yeah.
And we produced a groundbreaking products like the AI motor, the 812, and the RTFK.
Mm-hmm.
So for the customers and for woodpecker, what will be your advice for us for the future innovative solutions that it can be introduced to the market?
Yes. The next step or the next device to be produced will be the ultrasonic handpiece that can allow you to remove non-visible broken instrument.
Okay.
Yeah. And also I'm looking for a special irrigation device using ultrasonics.
Okay. And in conclusion, thank you for your time and sharing your insight with us, Professor Dr. Yoshi. We may continue our journey together, forging a brighter future for the field of dentistry. Thank you for being with us today.
Thank you for your questions.
Thank you. And thank you to the audience again.
Thank you very much.
So much.
Thank you.